Hello, everyone. So, if nothing changes about your healthcare today, where will you be in a year, in 3 years, or 5 years? I'm Dr. Lola Ashaye. I'm a family and lifestyle medicine physician and founder of In Touch Primary Care in Sugar Land, Texas. And here, what we do is we help you more easily become and remain healthy so you can live fully and enjoy doing what you love. So, this is a question I often ask, and many people pause because deep down they know the answer. A lot of people know that if they don't do something different, they're not going to be where they want. Many people delay care for different reasons. The most common ones I see, though, is cost, money, and time. Sometimes it's frustration about the complicated healthcare system, but the problem is delaying care is very costly. It's costly financially, emotionally, and physically. So imagine you're driving and one of your tires is slowly going flat. You have a choice. You can stop and fix it now. It may take a few minutes, maybe a small patch or some air. But if you decide to keep driving, after a few days or weeks, that small issue becomes a huge one. The tire is destroyed. Now it needs to be replaced. And if you've been driving on it long enough, you probably have damaged other parts of the car, like the rim or the alignment too. So what started as a simple fix becomes so much more complicated and expensive. And that's how health works as well. So when people ignore symptoms, when they skip checkups or delay care because it's inconvenient, these small issues turn into this huge chronic problems. So I had a patient, and I've told the story several times, where when I was in residency, so she, had diabetes, and now I was seeing her 11 years after her initial diagnosis. And by the time I was seeing her, she was blind in one eye. She was using a cane because she had neuropathy in her feet. So she was always in pain. She was in and out of the hospital because she had heart disease. And so she had to be hospitalized a lot. She was constantly going into heart failure. She was just miserable. And every time I saw her, she always regretted not taking care of her health earlier. And I happened to be able to look at her records from when she was first diagnosed 11 years earlier because it was a residency program. She'd been going there for a long time. She had had many different doctors. And what I noticed was her initial A1C was 6. So when she was diagnosed, she probably only needed one medication to control her diabetes. And, with some lifestyle changes, it could have been a whole different story. And I see this over and over again. And that's why I wanted to address it today. I've seen people who would say, you know what? I had diabetes. I was diagnosed 3 years ago, or maybe had gestational diabetes in pregnancy, and then they just never followed up to check to see if they've now developed diabetes, or maybe they've had pre-diabetes, or they've been told their blood pressure is high one time and they never followed up. And now they're showing up 3 to 4 years later and they say, oh, I lost my insurance, so I didn't, do anything about this. The problem is that the condition doesn't just stay where it started. So if, for instance, a person is diagnosed with diabetes today, and maybe they lose their insurance and they don't do anything to it for 4 to 5 years or even 2 years, by the time we see them those months or years later, things may have happened. By then it's not the same severity of diabetes anymore. Now it could have affected their kidneys, which is not reversible. It could have affected their heart. It could have affected their pancreas. It could affect so many organs, their eyes. So waiting is very, very costly. It doesn't make care more expensive, it makes care not just more expensive, it also makes it more complicated. And then it also creates damage that may never be reversed. So waiting is not a good idea. Okay. And so that's, very important. What could be treated with one pill today could need 3 or 4 medications and an injection in 3 to 4 years. So it's really important that if especially when we're dealing with chronic conditions that don't wait. It's not worth waiting. So I mentioned earlier that there are reasons that people wait, and we're going to talk about, the two biggest reasons, time and money. And I want to talk about money first. And I think there is a mindset that is really common in the US that can be very limiting, and it has affected a lot of people's health. And I think this mindset is, if it's not covered by insurance, I shouldn't do it. And I understand that insurance is important and helps protect us from big medical costs, but insurance is not health care. And so there are many people who have insurance and they still can't see a doctor when they need to, or they get 5-minute visits and they don't have real answers, or they walk away more frustrated than they were before. So having health insurance is not necessarily health care. And I think when we understand that our health is our responsibility, not the responsibility of the insurance company, it's actually really freeing because people start to take ownership of their health. And even when coverage is not perfect, they're not thinking about their health only when insurance is covering things. So sometimes it means that you're investing in yourself. So you're choosing to pay for a visit, a test, a membership that gives you the time, access, and personalized care you deserve. But don't delay your care and prioritize other things that, can be easily replaced in exchange for your health that oftentimes is not, you can't put a value on it. So at In Touch Primary Care, we see this all the time. We have members who invest in their health care early, and they often save money because they avoid urgent care visits, ER bills, unnecessary medications, and complications that come from waiting too long. It's always better to invest in your health now while the tire can still be patched rather than waiting until it needs to be replaced or worse. So there's good news, and I wanted to talk about this because some people just don't realize that there are actually options. So many clinics offer cash pay visits or payment plans. So you should ask if you have a doctor that you like seeing and then you lose your insurance for whatever reason, or you change your insurance and they no longer accept. Is it worth going on that cash pay plan? Think about it. Don't just assume that now you can't get care from them. And there are membership practices like ours where you can get detailed on-rush care, transparent pricing, and access when you need it. The point isn't about where you go, it's that you go and you don't delay your care. So just wanted to mention, don't let the lack of perfect insurance coverage be the reason that you stay stuck and that you delay your health care. So if this message resonates with you, if you know there's something you've been putting off, I invite you to take a small step today. If you're in the Texas area, you can schedule a free 15-minute consult with me, and we can talk more about if we'll be a good fit for you. If you're not, please find a place in your area, talk to your current doctor, figure out if there is a payment plan you can get on or a membership plan you can get on, but don't delay your care waiting because it really makes a huge difference. So imagine that instead of worrying about what may happen in 5 years, you already know you're on track. Imagine you're catching issues early, you're feeling confident in your health plan, you're seeing your labs and your energy improve, not by chance, it's intentional, it's by design. So that's what preventative care is about, and that's what we help people achieve every day. So I'm Dr. Ashaye. Thank you for joining me. And this is Connecting the Dots. Remember, your health is your greatest asset. Protect it today so you can thrive tomorrow.